Joining me right now, Professor Michael Hogue, President of the American Pharmacists Association. Professor, thanks for joining me. Right off the top, I just want to talk about medication, specifically within the hospitals here.
Sure.
Top of my head here, antibiotics, antivirals, sedatives. Hospitals reporting a shortage of medication. Obviously, that is a huge concern.
Well, yes, we always have to be sure that the medicines that we need in order to sustain life in the hospitals are available. And so we have systems in place nationally to try to prioritize access to those medications to those who are most acutely and severely ill. So that's our hospitals. And so we're working very diligently across the country to make sure hospitals do have, in fact, what they need. We have pharmacists within the hospitals who are managing those inventories and the outcomes of those medications. And so, you know, we're seeing some shortages, spotty shortages of some medications in some parts of the country, but medication supplies are improving, and we do think that things are getting better in that scenario. Of course, only time will tell as this COVID thing ramps up and how bad it gets, really.
Any danger, Professor, in using, because of the shortage in hospitals and doctors using kind of second line, third line, fourth line medications?
Yeah, we have to look very carefully at what we know from clinical evidence. I mean, we obviously want to use the medicines that we know are the most effective at treating a patient. And so I know that physicians and pharmacists alike are trying to select medications with that in mind all along. When we have shortages of medications, however, for example, if the big name manufacturers can't provide enough medication to the market because they can't keep up with demand or there's a supply interruption, we do have to remember that pharmacists, by their very training, know how to make medicines. I mean, that's part of what we know how to do. And so pharmacists can compound or make medications from scratch in the instance that we need to do that. And pharmacists are increasingly being called on to do that in some communities when they can get the active pharmaceutical ingredient to actually make the medicine from scratch, just like they would have done 40 or 50 years ago very commonly. So we're seeing more of that begin to happen now. And we're working very closely at APHA with the FDA to ensure that there's a good quality process in place for all of that to occur.
Let me ask you, since we're talking about manufacturing here, I mean, can you explain a little bit about the pharmaceutical supply chain here? I mean, do manufacturers, just in general, even before this pandemic, do they make enough?
Yeah, this has been a major controversy, and it's been a major shift of what's happened in our society, not just in the United States, but also in Europe. What has happened over time is that pharmaceutical manufacturing has shifted outside of Europe and outside of the United States, and largely now occurs in two countries in the world for the most part, and that's in India and in China. And so even the branded pharmaceutical manufacturers now rely heavily upon those two nations for supplying the active pharmaceutical ingredients that are used to make the pharmaceuticals that we take here in the United States and throughout Europe. So yes, it's a big concern because we have over time lost our capacity to manufacture drugs here in the United States. And this is a huge, huge debate right now in Congress. And the American Pharmacists Association is advocating that we look at pharmaceuticals as a strategic national asset, and that we began looking at ways to shift back to the US and to Europe the manufacturing capacity that we need to be able to use these, to have the medicines that we need for our consumers.
Yeah, key point right there. I mean, you mentioned China and India. I mean, factories that produce this or manufacture the medicine, I mean, they've been known to be shutting down because of the pandemic.
Yes, we hear that there are stories now of some of those factories beginning to open back up, but without a question, there's no doubt that those factories did shut down for several weeks, if not months. And so, you know, it's not surprising that we would have disruptions in the supply chain as a result of that. I think what the COVID-19 pandemic has brought to light is the fact that we have got to do a better job here in the US of making sure that we have the supply of medicines that our people need to be able to get through a time like this. And so hopefully we'll see some positive change on this in the future.
Any word on retail pharmacies on whether or not they are limiting the amount of medication that's being given out? I mean, specifically, I guess, to COVID-19 patients?
Yeah, I think the most important thing to know is that your community pharmacist is very much on your side and is working carefully to make sure that every single patient who comes into the pharmacy has what they need to be able to live a healthy and be a healthy life and be well. And so they're working very hard to do that. Remember that the pharmacist is there not just to put the medicines in the bottle and make sure that you have the medicines that you need, but to make sure that these medicines are working like they're supposed to. So talk to your pharmacist about your medicines and how they're working, and let's make sure that we're taking the right medicines in the right amounts. And that's what the pharmacist is there to help you do, and they're happy to do it. That's what their role is on the
I think it's important to know too, when we're talking about retail pharmacies, that people out there who are watching, I mean, this is a time where you don't want to hoard medicine. I mean, do pharmacists, I mean, they keep track of, how much you're getting, but I'm sure that could be a problem of individuals who are hoarding the medicine that they need.
Well, there's really no reason for a person to have more than at maximum about a 90-day supply of medication. I mean, for years now, insurance companies have authorized 90-day supplies of medicines. And we'd say that there's no need to hoard medicine beyond that. For one thing, there's no need. And storage conditions in a home environment are not the same as in a pharmacy. These medicines do break down if they're not stored in the right way. And so you may not have as effective of a medicine if you're trying to hold on to it for months on end. And then the second thing is it's just, it's not very caring of your fellow man. I mean, think about it. If we will share resources during this time, then everybody will be able to get through, and we'll be able to make sure that we have enough medicine to take care of everyone throughout this entire pandemic.
Since we have you, Michael, I just want to ask you about kind of off topic a little bit, but I mean, even myself, I'll use myself as an example. I thought I had symptoms, a few weeks ago, just the chills and a cough. And immediately I thought about COVID-19. I wasn't thinking about really anything else. Obviously those symptoms went away, but I think there's a concern among people that they're not looking. Maybe you don't have COVID-19, but maybe you have something else, but they're not even thinking about that underlying.
Absolutely. I mean, there's lots of things right now that are circulating and issues we have. I mean, the fact of the matter is we're entering springtime. Flowers are blooming, trees are getting their leaves, there's pollen in the air, and a lot of people who have seasonal allergies are having their allergies flare up. And of course, that's creating fear. But don't forget, I mean, you have allergies every year. People have allergies every year. So that's still happening. And, your over-the-counter antihistamines are the best way to stop those symptoms. So we still want to continue to treat allergies in the same way. And believe it or not, flu season's not quite over yet. We still are seeing community-based influenza transmission. And so influenza is a real possibility. Not everything you're seeing in the community right now is COVID. COVID certainly could be the case. The unfortunate thing is that we do not have enough testing for COVID available in the community to be able to know for certain what's going on. We're hoping that within the next couple of weeks, because of some action that's happening at the federal level, that hopefully we will be able to have more widespread testing where consumers may be able in the future to get a more rapid test. They may be able to walk into their pharmacy to get that test or some other venue, assuming that we have enough personal protective equipment to actually do those in pharmacies, but we're hoping we will. So stay tuned on this, because in the future, hopefully with enough testing, we'll be able to get some definitive answers on what's really going on.
Agree with you. Very critical. We need that. One for the road here. I mean, kind of a wide open question, but here we are, beginning of April. I'm just curious your thoughts on the state of where we're at in this pandemic here in the United States. How much longer do you think we're going to be doing this? And I'll open it up to you, Professor.
Well, it's a great question. I mean, we've looked at all of the public health modeling. Certainly, we are seeing some tremendous improvements in social distancing. I'm here in Southern California. There's no question that there's greater social distancing that's occurred, especially within the last week. That's improving things dramatically. But we have not yet hit the peak, unfortunately, of the number of cases or the number of deaths in this country. I think we're still a few weeks away from hitting our peak, and in terms of both the number of cases and the number of deaths in the United States. It could be as long as 3 or 4 more weeks from now. I think a very Optimistic efforts say that it might be another 2 weeks, but I'm predicting that we're probably looking at closer to the 1st of May before we see a nationwide peak in the number of cases and deaths. This is going to trail into the summer. There's people are going to need to just be patient, and are going to have to maintain their vigilance and social distancing, because this is not going to be something that's over with immediately.
Yeah.
But the better we do at this social distancing thing, I do have to say, the better we do at this, the quicker it will be over. So if we want this to get over with by early to midsummer, we all need to just do all we can to keep social distance from everyone else.
Yeah, here we are talking about medications, but in the end, it could be the SD, the social distancing, that is the best medicine for this country right now.
No question.
All right, Professor Michael Hogue, President of the American Pharmacists Association. Appreciate the conversation, and I hope you can have a great weekend.
Thank you. Thanks for having me. Appreciate it.